The White House is planning to ship 400 million N95 masks to pharmacies and community health centers. They will be available for free starting next week. The move comes as the surge in new infections is overwhelming hospitals and healthcare workers across the nation. Experts say vaccines and boosters are still the best way to protect yourself from the virus. Carter Evans reports from Missouri, a state with one of the lowest vaccination rates in the country.
Can you open your eyes for me?
At St. Luke's Hospital in Kansas City, Dr. Andrew Schlachter has been on the COVID front lines from the start.
Is this busier than the beginning of the pandemic?
Most certainly. COVID has completely fractured our lives, our personal and our professional lives. Our ICUs are jam-packed. The healthcare system, I think, in general, is bedlam.
Since early December, cases here have nearly tripled. Out of 286 COVID patients, just 15 are vaccinated. Pamela Maples is not one of them.
It's not something I would wish on anybody.
She was infected just after Christmas.
It sounds like you were scared to take the vaccine.
Yeah, I was. Everyone kept telling me not to.
What do you want those people to know now?
Take the vaccine. It's very, very important.
Only 53% of the population here is vaccinated, and statewide hospitalizations are at an all-time high.
Do you blame the low vaccination rates for all of these full rooms?
Yes.
Nurse Kristen Soller said she's seen so much heartbreak, and she's had enough.
It's devastating for us, and we're carrying it home with us, and we're sitting in our nursing station talking about how we're all going to need therapy for the next decade to handle this, and it didn't have to be like this.
Pam.
Moments after we left Pamela's room, Dr. Schlachter went back with a message.
Your willingness to talk today is going to save people's lives.
Thank God, yes.
Now, despite the massive surge in COVID cases here, Missouri's governor declared the pandemic emergency over 3 weeks ago. That emergency order gave hospitals flexibility to move staff around and add beds, and without it, they say they're struggling to keep up with the rising number of patients. Lana?
Carter, thank you. For more, I want to bring in Dr. Payal Patel. She's an infectious disease physician at the University of Michigan Medical School. Dr. Patel, always great to have you on the show. So we just heard from Carter that the Michigan Health Department has reported more than 86,000 new infections over a 5-day period on Wednesday. That's an average of over 17,000 infections per day. How are these cases and hospitalizations breaking down between the vaccinated and unvaccinated where you are?
Yeah, we remain the same as we have for months. Really, more than 3/4 of the folks who are in the hospital who are very, very sick remain unvaccinated. What's different this time around is that we're seeing a lot more people who are coming to the ER. And so we're full in different parts of the hospital. We're full inside of the hospital. We're full in the ERs. And I want to note that we're seeing more child, ER visits and hospitalizations. And that's because children remain one of the largest groups that are unvaccinated at this point.
And there's a new CDC study that found that vaccinations prevent hospitalizations more than previous infections. So I'm wondering, what might this mean for people who are still choosing to remain unvaccinated and relying on building natural immunity against the virus?
Yeah, for many, many years now, and really for decades, we've said in the infectious disease community, vaccine is the way to build your immunity, right? And we've seen that with COVID-19, that being vaccinated really helps prevent you from getting those serious outcomes that we just saw in that story, having to go into the hospital, be there for months. Many of the patients that we have still in the hospital have been here since November, December. And so you just don't want that upending your life. And I think I would go with the research, and this research adds to the body of research that shows that vaccine immunity is more effective.
Well, the American Academy of Pediatrics is reporting that nearly 1 million COVID cases were reported among children in the U.S. just last week. The virus obviously appeared to spare young kids during the early days of this pandemic. Can you tell us, Dr. Patel, more about the reason behind this spike in pediatric infections now, and how serious are these cases? I know a lot of people have been saying these kids are coming in for other things and they're getting tested for COVID, and so the numbers are artificially inflated. How serious is the pediatric case numbers that you're seeing in those cases?
Yeah, I think it's really important to realize, here at this point, 75% of Americans are vaccinated. So we're in a totally different place than we were before the vaccine. However, for kids age 5 to 11, where we do have a vaccine that's safe and effective, and we have seen very few side effects, only 25% of kids between 5 to 11 have gotten vaccinated. So that group under 12 remains a large group of unvaccinated people in the United States, and those are always going to be the people that are at risk. I would say it's even devastating to a family for a child to have a mild infection these days. It means you can't go to daycare, may not be able to go to school, parents have to stay home. So we've seen that definitely in healthcare. Many healthcare workers are also parents, but of course throughout the nation. So I think that really moving forward, parents of children should really think about getting vaccine uptake in their own households. That is really going to help in the classroom as well, try to get us out of where we are today.
So Carter was reporting from Missouri and the strain on hospitals there. You're there in Michigan, seeing it on the front lines. I'm here in New York City, and here it was one of the first places to really be impacted by the Omicron variant. But cases and hospitalizations do appear to be dropping in New York City. Tell us, what do you anticipate in other parts of the country?
Yeah, each city and state is so interesting. They have their own behaviors. The weather can be such a big thing. I know myself, when I go out to the grocery store, I've really seen mask use decrease. So I think that one thing that's really going to affect each group is going to be human behavior, as well as how many people are vaccinated in that area. That's really going to help determine the peaks of each location. My guess is that by the end of this month and going into February, places like the Midwest hopefully will start seeing a peak in Omicron.
And as that's going on, there are also flu cases that are on the rise once again in the country after reaching an all-time low last year. Tell us how this further complicates things, and if somebody hasn't yet gotten a flu shot, should they still go out and get it, or are we starting to approach the end of flu season now?
Oh, man. You're always, whenever you ask yourself if you're at the end of flu season, the answer is almost always no. Yeah. And it's never too late. Here in Ann Arbor, Michigan, we saw a very large outbreak of flu in college students. We had the CDC come out, and they decided that, really much of that was due to low uptake of the vaccine. And so I think a lot of people might be kind of feeling like, oh, I don't know, I got my booster, I don't know when I can get my flu shot. Really, the best way to protect yourself is a number of ways. One is definitely getting the flu shot. And again, doing the things that we were doing a year ago, wearing that mask in public places. That's going to be protective not only against getting an infection with COVID-19, also with flu and other respiratory viruses. The flu is always there in the background. So I would recommend all the viewers above 6 months old to get a flu shot.
Dr. Patel, I'm always asking, are we almost at the end of this? And I think that that's just channeling the frustration that everybody feels about all of this. Once again, I appreciate you coming on the show, and I appreciate all that you do. Dr. Payal Patel.
Thank you so much.